Hi, I'm Dr. Bruns, and this is my Class 4 45-watt laser. It is a pretty compact and pretty easy system to use, so this will just be a quick tutorial and show you how I basically jump through the interface and do a quick treatment. There is a safety procedure here, a few steps basically where I'm going to release the safety button, plug in a safety key in the back, and then type in my password, which is 31300. Once I've entered the system, I have the option of going by body region, so in this case I'll select elbow. I can look at skin tone or the size of the patient, the chronicity. I'll often just jump right ahead to the preset programming here so I can modify it to my specs. There's quite a range in the literature in terms of what settings are best. What we found is really anything works. The main thing is that the more energy you use, the faster you're going to get your treatment done. And so you want to balance that with other aspects, the patient's comfort, of course, and safety being the most important. The more energy you use, the harder this will be to keep cool on the skin. So constantly check in with the patient, constantly keep the laser beam moving on the skin so as not to build up too much heat. And as you see, I'm wearing safety glasses. Anyone within the room should be wearing safety glasses because this could be potentially harmful to the eye. So now that we have those safety checks considered, I'm going to look at my total watts here. In this case, this is actually pretty ideal for an elbow. It's going to take me a couple minutes to dose a couple hundred joules, which is my typical goal. Anywhere from 5 joules to 5,000 joules has been used in the literature for various conditions. So in my case, I go with sort of the average that I see out there. So I generally recommend around 1,200 joules or so. So now I have my pilot light on. This is a 650 nanometer wavelength. It is not producing heat here, but it is still therapeutic. I'm now going to engage the rest of the wavelengths, the 810, the 980, and the 1064, and I'm going to apply it to my hand here. And now I have the treatment going. And there's often questions about how far you have the laser from the skin. Relatively close, within a couple inches is best. In this case, the watts are fairly low, so I haven't been moving it, and I haven't really felt much heat yet, which is good, because I don't want to overheat. I'm starting to feel the heat now. Typically what I would do is go in quadrants, so I might move the laser every beep or so and cover a broad area. But when I do it this way, I'm actually giving time in between for each of the quadrants to cool off again. And this is effectively kind of pulsing the laser on and off by spot. And as I'm doing this, I could be considering as well the total joules that have been dosed. Right now I'm at a couple hundred joules, approaching 300 joules. Since I'm trying to put a couple hundred joules in per spot at minimum, I'm probably going to want to do about 1,200 joules or so in this case. So I can cover the entire palm with a few hundred joules per spot. So 1,200 joules divided by 4 gives me a couple hundred joules per area, and that is a very solid, significant dose. It's going to get great results. So I'll pause here rather than doing a full treatment. If I wanted this treatment to go faster, if I could tolerate the heat, I would just go ahead and put it back into safety mode or to standby mode. And I would turn up my peak volume. So now I'm at 45 watts. Let's see how I tolerate this. It's going to be much warmer. I'm going to have to probably move it a little bit faster. So now I'm going about 1 spot per beep or per second. I do feel significant heat. I typically keep it just an inch or so from the cage on the laser head. And as I go through this, it's not overheating for me. This is higher than I would typically do on a hand. I might only use 45 watts on like the low back or really large area, but I'm tolerating this well. If I were to keep it still for a few seconds, I'd start to feel a little bit too much heat. Even now I'm not burning, it's fairly comfortable. But more heat isn't really our therapeutic goal. Our therapeutic goal is to dose the light, energy, and to make sure we're not burning the patient. So a little bit of pleasant warmth is our goal. We don't really want a lot of heat for the patient. Don't let a patient convince you that they need more heat or less movement. More isn't necessarily better. We just want to make sure the skin is always in a safe temperature. And with this setting, I've been moving much faster. I've actually dosed about 1,600 joules, including the 300 to 400 I did initially. So you can do a treatment in under 5 minutes quite easily. But that's a basic application. I could apply that to any body part. You don't necessarily need to follow a recipe. Every study out there is going to vary widely, so just keeping it somewhere beneath 5,000 joules, so between 5 and 5,000 joules is reasonable. 500 joules per spot would be more than enough to treat therapeutically under the spot beam. So I typically am closer to 1,000 and treating 4 spots per session. So a couple hundred joules is going to be sufficient, but you'll cater to what the patient needs, how many spots you're treating per session, and you'll adjust from there. But it's pretty easy when you take off the restraints of all of the parameters or study settings that you could use and just go by that basic principle. A couple hundred joules per spot, making sure you keep the laser beam moving, that the patient's always comfortable. That creates a really effective treatment in just a couple minutes and makes it really easy, so you don't have to remember much, and you can just go ahead and treat your patients and move on to the next modality, exercise, or patient that's waiting for you in your treatment room.